Yes. Good afternoon. Good morning. Thank you so much. We have been a bit quiet, but we are back with another video that talks about the common things we do that are great mistakes, our oral hygiene or our oral health. These are habits that we do sometimes intentionally without minding that they can be very dangerous to our teeth or to our oral cavity. Number one, I already talked about a video on brushing, but now we are talking about a mistake we do in brushing. Usually, we said the main reason why we should brush is to remove food from our teeth or from our around the teeth in our oral cavity or in our mouth. But many of us, the mistake we do is that we brush after, before breakfast. Most of us wake up very early, brush, and we leave the toothbrush in the bathroom, and after eating we enter a car. Some of us have cars, and you put your car near your driving, in the co-driver's seat or near the driver's seat. You drive as you're drinking. You are not going to brush again. That one is a great mistake, because you're not going to brush your tongue, you're not going to brush your teeth. It means that the reason for brushing is not obtained. That is very common. Most of us do that. Students do it, working class do it. Brushing after meals is the most important thing, but most of the people brush before eating or before putting food in their mouth, and that becomes what? Useless. Another mistake, this one is usually done in parties. Mistake number two is using your teeth as tools. You have seen people just grabbing a bottle of soda or beer, trying to open. Some do it for fun in order to help others and their function. Others do it not knowing that it is very bad, but this is the second mistake we do. When you open a bottle using your teeth are not meant for opening bottles. There comes a crack in the teeth. This crack is the beginning of entrance of bacteria in your tooth. At the long run, we shall have things like cracked tooth syndrome, or we can have dental caries later, which can come as the entry, where the entry of bacteria in the tooth is through that hole created when you are opening. So that crack that is made when you're opening sodas, opening bottles of beer, opening other beverages, is very, very dangerous to our teeth. Unfortunately, it is too small, or what we can call microscopic, that you may not see it immediately, but you can realize at a later age, at a later time rather. Another mistake, smoking. Smoking is not good. Smoking increases the risks of oral cancer, cancer of the tongue, cancer of the oral cavity, cancer of the mouth, cancer of all kinds. Smoking is not good. Smoking increases a risk of halitosis. We talked about halitosis in the previous video. Halitosis is the bad breath. It also can increase on staining of teeth. That staining or a coating on the teeth, which increases a risk of tooth decay and, of course, halitosis as a secondary effect. We also have another one where we shall maybe expand it in another video about poor wound healing. Poor wound healing, when you smoke, you make your body less strong to fight when you have a wound, and you can make it have poor wound healing. Another mistake we do, mistake number 4, is use of toothpick. We said we need to use a floss. But usually, and many times, someone eats meat and you find someone entering the gum, pressing the gum, putting a toothpick between the teeth in that gum as if it is not his. This one is very bad. You need to use a floss. We talked about use of a floss at least once in a day. The toothpick is bad because it injures the gum and causes gum to bleed, which is the beginning of gum infection or gum disease. Another mistake is what we shall expand in another video, but we can just highlight it for now as false teeth extraction. This is a very common mistake where our mothers, or most of our mothers, our friends, they have children who are having erupting teeth and they run to people who are not educated, or people who are going to make their children suffer. Because the moment a primary tooth is coming, it will come with the symptoms of itching, sometimes diarrhea, sometimes vomiting. And when you run to the witch doctor, or you run into someone who is not educated and is going to pierce, to get either a long nail to pierce your child, is going to bring tetanus to the child. It's going to bring HIV, or is going to bring infections, all types of infections, because these instruments they are using to pierce in the gum of your child, they are not sterilized. They are not educated to know where the nerve is, where to start to anesthetize or not. So for you taking your child for false teeth extraction, what we normally call a vinyo here in Uganda, other people can call them other, maybe other names in other countries. But these are things which can be managed. You can manage this avenue, or what you call false teeth in quotes, by managing signs and symptoms. Do not tamper with someone's dentition that you're helping them. It is related to the sixth mistake, which is use of herbal. People also use herbal medicine, which is good, but it is not good for you to overuse herbal medicine, which is not indicated by your doctor. Usually we cannot say all herbal medicine are bad, but usually we normally find a problem where people get sensitive teeth. We talked about stages of teeth infection. When you have a sensitive tooth, it means that the tooth can be cemented. When the tooth is paining, the tooth cannot be cemented. But now, even if it's supposed to be cemented or not, you should take this tooth to the dentist, a qualified dentist, to be worked on. But usually, people who sell herbs, they will tell you, get this, and unfortunately, we are having some pharmacies that sell these liquids in form of medication, in form of mouthwashes, and they say you go and do what? And rinse 2 times a day. By doing that, they are giving you a painkiller in the evening, in the morning, in the evening, in the morning. The disease, remember I said, the diseases of teeth are not reversible. So instead of removing the cause, for you only remove the symptom. It is like when you're having a problem with your car and the dashboard is showing you there is a problem and is showing you something red and you cover the dashboard. You don't want to see the problem. This is what happens when you have a problem and the tooth is telling you, I'm having pain here, I'm having sensitivity, and you're taking herbal medicine or that painkiller to stop the pain. It is good you have stopped the pain, but the infection continues or the disease continues. You shall end up having a tooth which is swollen. Maybe dental abscess, like in the previous video you have been watching, that shall end up having someone who's infection or tooth condition extending from the jaw maybe to the neck and maybe to the chest and to the heart, which can be a problem and a very big problem. We also have other diseases, other mistakes rather we've talked about, like disease like mistakes of oral hygiene. We normally have issues where we buy our children toothbrushes. Thank you so much. You brush your children. Thank you so much. You brush their teeth. But the mistake is not caring or not buying for the attendance of these children these things which help in maintaining oral hygiene. For example, toothbrush. Your child brushes all teeth very well. That is good. You brush the tongue very well, you floss. But when you go away and you go to work, this maid or this attendant remains with your child. They buy sweets or they have toothbrushes they can get from their mouth and the child may lick. They can get a sweet and share sweets. They may even, some of them even kiss the children. This one is very bad. As you buy toothbrushes for your child, you also need to buy for what? For the maid or for the attendant. Or as you brush your teeth, make sure if you are a mother, as you brush your teeth, they should be in a way that you should not transmit problems to your child. If you can avoid kissing children or sharing toothbrushes, it would be very good, because this one affects children in the other way. There are so many mistakes, but for now, we can say those are the common mistakes that we do. In order to understand more of these videos, try to subscribe and you follow us on our next videos. Thank you so much.